So let's talk about anxiety. You know that feeling, right? That knot in your stomach, your heart racing a little bit. It's a completely human experience. But when does that feeling cross the line from a helpful warning sign to something that's, well, taking over? That's exactly what we're going to unpack in this explainer. I mean, that little flutter in your stomach, that feeling of anticipation, that's anxiety at its most basic level. It's our body's built-in alarm system, a survival instinct that's been around forever to get us ready for a challenge. But as you can imagine, for millions of people, the story is a lot more complicated than that. Okay, get ready for this number, 301 million. And that's not just some abstract statistic, that's the estimated number of people right now living with an anxiety disorder worldwide. I mean, think about that. That's nearly the entire population of the United States. This is so much bigger than just pre-meeting jitters. It's a massive global health issue, and understanding it is absolutely critical. So, what's the dividing line? When does everyday anxiety cross over into a disorder? Well, it really boils down to three key things. It's when that feeling becomes excessive, when it's persistent, meaning it just won't go away, and when it's completely out of proportion to the actual danger. It's when that feeling starts getting in the way of your job, your friendships, and your ability to just, live. All right, to really dig into this, we're going to look at anxiety through two totally different lenses. We'll explore a couple of major medical systems and see how they understand these conditions and, maybe more importantly, how they go about treating them. And trust me, this is where things get super interesting. Okay, so on one side, you've got modern medicine. It's super structured, right? It uses diagnostic manuals like the DSM-5 to pinpoint specific disorders. And the treatments are often evidence-based, things like cognitive behavioral therapy, we call it CBT, and medications like SSRIs. Then you've got the Ayush system, which includes traditional Indian practices like Ayurveda and yoga. It takes a much more holistic view. It's all about this idea of restoring balance between your mind and your body, using lifestyle changes, herbs, and practices like yoga. Okay, so that's the theory. But how does this all play out in the real world? Let's take a look at two of the most common anxiety disorders and see these approaches in action. First up, we have generalized anxiety disorder, or GAD for short. Now, if you think of anxiety as a sound, GAD isn't a sudden, loud alarm. It's more like a constant, low-level hum of worry that just never, ever shuts off. And living with GAD, wow, it is absolutely exhausting. I mean, it's not just the constant worrying, which, by the way, can go on for 6 months or more. It's the physical toll it takes on your body. You're feeling restless, you're tired all the time, you can't focus, you're irritable, your muscles are always tense, and sleep is a constant struggle. It's like being stuck in high alert mode 24/7. So when we look at how to treat GAD, you can really see the two different philosophies at work. In modern medicine, often the first line of defense is going to be something like CBT and medication. The AUS system, on the other hand, its main approach is this incredible form of counseling called Sattva Vajaya Chikitsa. It's all about training the mind and reining in those negative thoughts, supported by things like yoga, meditation, and even specific herbal remedies. All right, let's switch gears to our second example, panic disorder. And if GAD is that slow burn, panic disorder is like a sudden explosion. It's defined by these overwhelming episodes of intense fear that feel like they come out of nowhere. Okay, we really need to understand this. A panic attack is a terrifying, full-body experience. This isn't just feeling scared. It is a tidal wave of physical symptoms. Your heart is pounding out of your chest. You have chest pain. You literally feel like you can't breathe. And for so many people going through this, they genuinely feel like they are dying or having a heart attack. It's that intense. And again, the treatment approaches really highlight the different mindsets. For modern medicine, the gold standard here is CBT, often using a really smart technique where people are safely exposed to those physical feelings, which helps them learn that the feelings themselves aren't dangerous. AUS, in this case, plays more of a supporting role. Think yoga, meditation, slow breathing, all designed to help calm down that overactive fight-or-flight system. So, we've laid them out. Side by side, modern medicine here, Ayush here. But here's a really powerful question. What if it's not about choosing one over the other? What if the real power, the real future of mental health care is in bringing them together? And this really gets to the heart of it. Think about it. What if by combining the hard evidence of modern treatments with the holistic, culturally aware practices of AIUS, we could actually get better, more lasting results for more people? It can make treatments more accessible and more acceptable to different cultures. So what does this actually look like? How would this integrative care work? Step 1, you start with a clear, standardized diagnosis from modern medicine. No guesswork. Step 2, the core treatment is evidence-based, something like CBT. But then, and this is the game changer, you bring in that holistic support from Ayush. You add yoga, meditation, mindfulness, things that help manage stress on a daily basis. You monitor it all together and create a plan that treats the whole person. Okay, everyone, listen up, because this might be the most important part of this entire discussion. Knowing all this stuff is fantastic, but it's absolutely crucial to know when it's time to raise your hand and ask for professional help. So here's the bottom line. If you feel like your anxiety is constantly getting in the way, if it's stopping you from going to work or school, if it's damaging your relationships, if you find yourself avoiding things you used to enjoy, or if you're using substances to cope, or, and this is vital, if you're having any thoughts of self-harm, please, that is a huge sign that it is time to talk to someone. And one more thing, this is incredibly, incredibly important. Yes, chest pain, fainting, severe shortness of breath, these can happen during a panic attack. But they can also be signs of a life-threatening medical emergency, like a heart attack. You can't risk it. You just can't. If you experience these symptoms, you need to get immediate medical help. Rule out the physical stuff first, always. So that brings us to our final thought. We've got these incredible evidence-based tools from modern science on one hand, and on the other, we have thousands of years of ancient wisdom focused on the mind-body connection. So could the future of mental health care really be about bridging that gap, not choosing a side, but building a bridge between ancient wisdom and modern science? It's definitely something to think about. Thanks so much for watching.